I'm Rosalind Nieves, and welcome to QPTV's Health Corner. I'm at Jamaica Hospital with Dr. Luchunga, and we're going to talk about the Enterovirus. It's on everybody's mind. Dr. Luchunga, welcome to the show. Thank you so much for joining me and taking the time out to do this interview.
Thank you. It's a pleasure.
How long have you been working for Jamaica Hospital? Let's start with that, though.
A long time, since 1991.
And you've seen a lot of children over the years.
We see this is a very busy pediatric ER in the city, and we do see a lot of children every day.
So let's talk about the Enterovirus. What should parents know about the Enterovirus?
They should know that this is a virus that presents and affects children with a common cold type picture. So children are going to have common cold symptoms such as a runny nose, a fever, cough, an upper respiratory infection. However, the majority of the children will fare out pretty well from this illness, but those that have chronic respiratory conditions, such as children with asthma, for instance, children who are immunodeficient, can be affected very badly.
Okay, what age group are we looking at with the Enterovirus? What age group?
Children, younger children, even school-age children, but little ones, toddlers, infants too.
And what should people do to be proactive? What are the tips that parents should do to prevent their kids from being contagious?
The most important thing that anybody should do is to prevent that you get infected by simply following the most simple measures, but they are very, very efficacious. You have to wash your hands regularly. Soap and water is perfect. But you also have to, as we know from the flu season, know how to cover your sneezes, how to cover your cough, and prevent yourself from touching those that are sick, and treat the child as he has a regular common virus, like cold symptoms. That's what you should do.
So if your child starts to show some of these symptoms, should you go to the pediatrician first, or should you go directly to the hospital? Because parents are going to panic.
Sure. Depending on the degree of the severity of symptoms, the child should seek care from their medical home, their regular physician first, and if the child is in very serious condition, by all means, go to the nearest emergency department.
And with your expertise, how long are the symptoms? Does it last 1 day, 2 days, a week? The flu, sometimes it's a week, sometimes it could be 2 weeks. Am I right?
Yes.
So what about the Enterovirus?
It is a similar situation. You can have symptoms just for a few days, as any common cold. But if you are seriously sick with more inflammation of your respiratory tract, like the kids with asthma, then you are going to probably end up being treated in a hospital with more supportive measures.
Now let's talk about prevention. Sometimes, you suspect your kid has or your child has a cold. Should they be going to school?
In general, the dictum in our school system is that if you have no fever for 24 hours once you have been ill with whatever illness, you can attend school. But use common sense. If you have a kid who has a lot of sniffles and runny nose and is coughing, it is not good for him to be in school. He's not going to be learning. He needs to rest. And you should keep your child home if that is the case.
Thank you for those tips. That was wonderful advice for our viewers.
Thank you. Thank you.
That's it for this segment. I'm Rosalind Nieves, and I'll see you next time on QPTV's Health Update. Thank you.